is MRI identified in the brain on 3 Tesla system with the specialized epilepsy protocol. Video EEG, the ictal EEG record does not show any epileptiform discharges. The interictal EEG shows the delta range slowing, and there was some left hemispheric slowing noted which build up around F7. We did a PET CT in this patient. There was mild hypometabolism in the left mesial temporal and both basal ganglion and thalami. So it was very difficult to conclude at this point also, and the opinion is sharply divided between whether it's a temporal lobe epilepsy, because the ground for making a diagnosis of epilepsy were also equally poor, and we cannot of course confirm this Alice in Wonderland syndrome with the headache. This point we did a EBV which shows a very high level of IgG 600. So EBV is now related to many neurological disorder, and in this Alice in Wonderland syndrome happens to be one of it. So I think this is all, and Gagandeep has already covered. Migraine with aura, they produces black and white pictures, maybe a color, and in seizure usually it's a colored images. Onset and duration, the formed visual hallucinations are rare in a migraine with aura and likely a temporal origin in the seizures. So this is it. I think I am going to stop here. The question is open whether it's Alice in Wonderland syndrome with the headache or still it's a seizure. Gagan, any comment on this? Yes.
So it can actually happen in anything, you know, it can in any of these disorders which he has, Dr. Sanjay has illustrated and listed out here.
So Montelukast is a newer drug which we uses, and I am in a habit of asking if the patient is using a Montelukast whether they get a visual hallucination or a visual aura of this kind. So I end here. Thank you.
So any more question? If it is, then we should conclude the session with here. And
now I would like to request Dr. Nachiket sir and Dr. CM Singh sir to give away the memento to Dr. Gagandeep Singh sir and Dr. Sanjay Sharma sir. Now I would like to request Dr. Sanjay Sharma sir and Dr. Gagandeep Singh sir to give away the memento to Dr. Nachiket sir and Dr. CM Singh sir. We will start the next session after the lunch at 2 p.m.